What is the cause of intradiscal granulation syndrome? When a minor crack occurs in the annulus fibrosus of the disc, tissues such as new blood vessels and nerves grow along this damage. It can be chronic inflammation like the calluses shown in the picture. It can be diagnosed with intradiscal granulation syndrome. If we compare a disc to a tire, intradiscal granulation syndrome can be thought of as sticking a nail in the tire. On the MRI, the callus appears as a white high signal intensity zone. For an accurate diagnosis, discography using a very thin needle is required. This allows a reliable diagnosis of intradiscal granulation syndrome. First, it's hard to sit for a long time, so you can feel restless. Second, the back does not straighten when standing up after sitting for a long time. Third, the back may sprain frequently after exercise or labor. Fourth, you are reluctant to lift even light objects. Fifth, it is difficult to maintain the same posture for a long time. Lastly, bending forward becomes particularly uncomfortable. Radiofrequency therapy using an endoscope can help patients relieve their symptoms. Look at the picture. You can access it using an endoscope and selectively remove only the callus without touching the nucleus pulposus. Look at the MRI on the right. This is a picture of the granulation removed well after the procedure. You are watching disc treatment now, actually looking at X-rays. A thin endoscopic tube is inserted and selectively treats only the back of the annulus fibrosus, selectively treated using high frequency. During endoscopic procedure, the patient does not feel any discomfort because the treatment is sufficiently cooled through the cleaning solution. In this case, the patient was an athlete. She has visited the hospital because it was difficult to exercise due to long-lasting back pain. If you look at the pre-operative MRI, intradiscal granulation syndrome as white color is identified. Through simple endoscopic radiofrequency treatment, she got a lot better after the procedure and was able to exercise actively. In most cases, it is completely cured with a single treatment because it even leads to the causal treatment. It takes about 5 minutes to approach while looking at the X-ray, and the treatment time can be as fast as 10 to 20 minutes. Because you can do daily activities right after the treatment without general anesthesia.